Do you know one of the most common drugs that are used to treat osteoporosis, ladies? I'm Dr. Wendy, physical therapist, and I take care of women, and I'm here to tell you about osteoporosis because prevention is better than treatment. But did you know hormone replacement therapies is one of the best ways to stop your bone loss? Estrogen is a water-loving molecule, but it's not just a water-loving molecule. It actually helps with a gazillion things in your body. And guess what? Bone density happens to be one of them. So hormone therapy that is begun during late perimenopause, menopause, early postmenopause helps prevent bone loss. Now, if you're just taking estrogen all alone, well, you aren't taking it right. I am talking about hormone replacement therapy. So if you are postmenopausal and you are starting to take hormone replacement therapy to help your bones, guess what? You're going to have a bone gain of 3 to 5% over a period of 12 months. That's huge. Not to mention, it will probably help with a host of other things like sexual side effects, brain fog, fatigue, things of that nature. Other things that are used to treat bone density issues, guess what? Calcium. I usually like Citracal Petite for my patients because if you have a hard time swallowing pills, calcium pills can be quite big, but Citracal Petite are the smallest pills. D3 with K2 is a non-negotiable for my ladies. Boniva is a drug that is quite popular. So is Fosamax, but Boniva and Fosamax have these side effects that can cause joint pain and sometimes increased risk of fracture. But if you don't do well with those, then you have the option of using another really cool bone density medication. Prolia is amazing for my patients, and I say this because I'm watching these women and their DEXA scan of 3.3 going to like 2.8, and that's pretty huge. So I get in a perfect world, we don't want to take any medications. We don't take any supplements. I get that. But as a women's health physical therapist, when we talk about DEXA scans, when we talk about significant bone loss, when we talk about your T-score is minus 2.5 and you are now osteoporotic, not even osteopenia, and then you creep up closer to 3, this is when those medications have to come into effect. But there are many side effects that aren't necessarily the best. But when you enter that 3 zone, my people, I recommend you're going to have to do those drugs. And listen, this is why I'm having this talk with you guys, so that you can get ahead of it and not let this happen. Hit the plus sign and follow for more women's health and wellness tips.